and welcome to this podcast series sponsored by Aster Hospitals. This episode is all about urological health. We speak to Dr. Sachin Arakere Nataraj with over 18 plus years of experience, a specialist in treating urological cancers. He's also performed robotic surgeries and handled renal transplants. Hello, doctor. Welcome.
Thank you.
Let's begin like this. What are the common mistakes or the symptoms that we ignore?
Urological cancers are the cancers which affect male or female urogenital organs. So they can be kidneys, prostate, bladder, penis, or adrenal glands. Some organs are quite common in both the men and women. So say like kidney, bladder, ureter, and adrenal gland, they're present in both men and women. So any cancers which affect these organs are called urological cancers. The most common symptoms, one which can anticipate, is blood in urine. Okay, so anybody who has blood in urine should go themselves get it treated immediately. If it is even one episode, they should go to a doctor and get themselves checked.
Most of the time it's ignored, telling that due to excess of heat.
Excess of heat, some people think it is due to stone, or some people think that it is due to UTI, especially women. Some people think that it's a spotting during menses. Okay, so they misinterpret as bleeding which is happening during menstrual cycle. So any blood in urine, even if it is a single episode, they should go to a doctor and see. The second most common symptom is pain. They can have low backache or abdominal pain. So pain is a vague symptom. So pain can happen with some bowel disturbance. If you have any loose stools, if you have any gastritis, you can have pain. So persisting pain, if pain is there, one episode of pain is okay. If persisting low back pain or flank pain, they should go themselves and check. Any swelling, unexplained swelling presenting in the tummy, they should go themselves and check. Okay, if you have loss of appetite or loss of weight, they should go and check. More often, people don't have any symptoms. Okay, so these are the symptoms. If they are present, they should go and get themselves checked.
Okay, like you said, it affects both men and women. Who is at risk? What are the risk factors?
So men in general are more prone for malignancies than women.
Okay.
So if you take any cancers, they are more prone.
Okay.
Except for organs which women have. If you take malignancy, in general they are more prone. So it's mostly seen in people who smoking. Okay? Smoking is the most common risk factor. Second is for kidney cancer. First we'll talk about kidney cancer.
Okay.
So men and women are equally affected, but men are slightly more affected than women.
Because of the smoking habit?
In general.
Okay.
So because of the demographics, more men are there. The incidence of cancers are common, more among men. The most common risk factor for kidney cancer is smoking. Okay, so people who smoke regularly, say like for longer duration, they are more prone for cancers. And kidney cancers develop in people who are more than 50 years. So although nowadays we are seeing people who are less than 30 or 40 getting kidney cancer, but people are older. Women over 50, they can get kidney cancers. Second is the obesity. Third is uncontrolled hypertension. Fourth is people who are working in industrial plants, who are exposed to chemicals. They are prone for cancers, kidney cancers. There are something called hereditary or genetic cancers. People who have, suppose a person who has a kidney cancer, if somebody in his family had suppose his mother had a breast cancer, or somebody in his family had a colon cancer, or somebody in his family had liver cancer, they are prone for kidney cancers and prostate cancer also. So they are prone for hereditary cancers. So family history of cancer is very important. If somebody in your family has a cancer, they should be aware that they are having cancers, and they should go themselves and get checked.
What can people do to reduce the risk of these maybe prostate, bladder cancer or kidney cancer?
Okay, so there are two types of things they can do. One is they themselves should go and themselves screen. Okay, so this is called awareness. For kidney cancer, any patient, any person, any man or woman who are above 40 years, they should go themselves and get their annual health checkup done. We have something called mass health checkup, where you get an ultrasound of your abdomen. So doing an ultrasound will detect kidney cancers. Okay, So when it comes to prostate cancer, so doing a simple blood test called serum prostate specific antigen will detect prostate cancers. Okay. So if there is any urine test, they get it done. If there is blood in urine, then we can do an ultrasound. We can detect bladder cancers. In this way, awareness is the key. Before any symptoms comes, they should go themselves and get themselves evaluated. It's stressful to doctor. It's stressful for patients. The earlier we detect it, the better is the cure.
How early can these cancers be detected, and what is the prognosis if it is caught early?
As I said, kidney cancers, if anybody goes to a sonologist, get their mast cell checkup done, we can detect it as early as possible. Say tumor is less than 3 centimeters. We call it as a small renal mass. Okay. So when it is small, we can just remove the tumor and save the kidney for kidney cancer. For prostate cancer, if a person who is above 40 or 50 years gets his PSA, and if it is elevated, if we catch it early, we can remove the prostate and cure it. So for stage 1 or even for stage 2 cancer, the survival rate is up to 90% if we catch it early and treat it. So early screening and early detection is very important.
This question is commonly searched on the search engine, doctor. I would like to cover this. Does sexual activity have any link to prostate health or any urological cancer?
Sexual activity as such are known to predispose patients to sexually transmitted disease. Okay, so suppose patient as somebody has penile cancers or women has a cervical cancer. So sexual promiscuity has been known to be predisposing factor to penile and cervical cancer. There is something called papillomavirus which can be sexually transmitted. So sexual activity, that is sexual promiscuity, is known to cause predisposed to penile and cervical cancer. As such, for when it comes to prostate cancer, your question might be frequent ejaculation. So that is not known to cause any cancer or decrease the incidence of cancer. Ejaculation is anyway good, but it's not known to increase or decrease the cancer.
What are some common mistakes that people do when it comes to diagnosis or treatment?
Yeah. So as I said, first, one of the common symptom of urological cancer is blood in urine. So suppose a man has blood in urine, he thinks first thing is I might have stone, so he'll drink more water, he'll think that stone will go off.
Self-medication.
Okay, self-medication, self-treatment, self-diagnosis. Second is Google, they search Google. Okay, in women, blood in urine, they think it is UTI, they don't get it treated. Pain in the back, they think it is a muscle catch, neglect it. Okay, so loss of weight, loss of appetite, they think there is some problem in the tummy, then they don't go to doctor. So these are the myths. They should avoid it.
When we say, these days we say that there is a lot of advancements in medical field. Why is it that people still go to different countries? One, that question. Second, what is the recent developments in urological cancer specifically?
Okay. So when it comes to Kannada actor, those treatment can be done in India as well. Okay, so we have all the latest technologies available. He had some other issues also, so he had some comorbidities. So basically, Mr. Shivraj Kumar had bladder cancer. He received chemotherapy, then he had to undergo surgery, which was done in Miami. It was an open surgery, okay, because they couldn't. When we do robotic surgery, we made it down, so he had some stents, so probably they couldn't do it. So it was done open surgery, and a new bladder was done, formed for him, which we can do in India as well. Okay. So most of the technology and the know-how of all this treatment is from the Western data. Okay. So we are also advancing in that field. But people who are affordable, obviously they can go outside and get the treatment well. Okay. So in India, it's not like we are not doing this, we do it. Coming to latest technology, so we have something from diagnostics to therapeutics. Diagnosis is detecting, therapeutic is treating. When it comes to diagnosis, we have for prostate cancer, we have advanced 3 Tesla MRI machines which can detect prostate cancer in exactly the prostate. We have something called MR transfusion biopsies, which can just do a biopsy of a specific point in the prostate and detect cancer. And we have PET CT to stage the disease where exactly the disease has gone. And when it comes to treatment, we have something called robotic surgery. So with robotic surgery, with it's not latest one. It's there since 15-20 years now. So it's a precision surgery where there is less blood loss, less pain, early recovery, and the functional outcome after the surgery is better. Suppose we are doing kidney surgery, we are removing only the tumor for kidney cancer, we can save the kidney. We are doing prostate surgery for prostate cancer, we can remove the prostate. One of the main issue with prostatectomy is patient becomes incontinent. Incontinence is leakage of urine. With robotic surgery, we can precisely take out the cancer and make the patient continent. Another thing is their erectile function can be preserved. So the robotic surgery is the latest advanced thing which is present for 15 years, and there is improvement with robotic technology also. When it comes to an advanced disease, we have something called immunotherapy and targeted therapy, where even for stage 4 disease, these medicines can be given, and even stage 4 disease can be cured nowadays.
Joe Biden's prostate cancer, actor Shivraj Kumar's bladder cancer. I'm sure they have spoken about this and they have created a lot of awareness. What more do you think as a doctor? I'm sure you see a lot of patients. We should do to bring in awareness.
So I admire them. So if you see many of the celebrities, they hide their disease, right? So Joe Biden, being an American president, they were open to that. They said that he has metastatic prostate cancer. So it created a lot of debate among American population, medical fraternity. How can American president have a metastatic prostate cancer, that to stage 4 prostate cancer? So, and Shivraj Kumar, he has come out and he has told that he had bladder cancer. He has a new bladder. Telling that he has a bladder cancer, he underwent chemotherapy, he has a new bladder. That itself is sufficient for general population to think that bladder cancer is, I mean, it can be cured. Okay, so it's if you go at a particular stage to a particular doctor or uro-oncologist, proper treatment can save somebody's life.
We've covered everything that I have made a note of. So before we wind up, is there anything else that you would like to add?
Don't neglect your symptoms. Okay, so go to your doctor, GP, general practitioner, get yourself evaluated. Or when you're after 40 years, get a mass cell checkup done, get your ultrasound, get your blood test, get your urine test. You can detect basic any cancers. It can be detected. If detected early, it can be treated, cured.
Thank you so much, Doctor, for sharing a lot of information. Thank you.
Thank you again. Thank you for giving this wonderful opportunity. Thank you.